This podcast is brought to you by Infinite Resources, a local staffing agency connecting diverse job candidates in central Iowa companies.
Amplified.
What up out there in social media world? This is Dr. Nagu Imhotep coming to you with enough information on issues that you need to be concerned about. Today I have as a guest Mr. Dennis Henderson. A good friend of mine. Before we get off deep into this, I want to first give shout out to the sponsors, Amplified, DSM, our sponsors, and also Infinite Resources, a recruitment marketing company here in Des Moines, Iowa. And go ahead, Mr. Henderson, introduce yourself and tell the listening audience who you are. Hello, la, la, la.
Okay, so my name is Dennis Henderson, and I'm the program coordinator for the TEACH Apprenticeship Program, which is located at Broadlines. I've been there for 7 years. I've also been a lobbyist up at the Capitol, fighting for Justice Reform Consortium, juvenile justice issues, as well as criminal issues. I was an advocate for the Minority Impact Statement, which the infamous Wayne Ford created while he was at the Capitol, and we did a lot of advocacy for that as well. I was the reentry program coordinator for Urban Dreams for a long time, and I still have a good connection with them as well.
That's wonderful, man. I'm gonna give a big ups or a shout out to Big Wayne. We have to bring him in here one of these days so he could light up the social media. Dennis is a friend of mine. I met Dennis almost about 8 years ago. Longer than that, 10 years. 10 years ago, and we became allies. You know, he's an associate, a good friend, somebody I can talk to. But today our subject matter is going to deal with healthcare. And you being a professional in a healthcare profession, I was looking at some information just recently that by 2025 there's supposed to be a shortage of 2.5 million nurses in the United States. And you have a program that can do something to help with that. Would you like to enlighten the listening audience about what you do?
Okay, so we started the Teach and Tech Apprenticeship Program about 7 years ago. And during that time, we have managed to not only turn it from an internship into an apprenticeship program, and now we have started, we've got a grant from the state of Iowa to start our RN program, pilot program. So we go and get people with barriers to employment to come to our program. We get them their CNA license. It's accredited through the DMAC institution, and this allows them to go to the next step. So what we try to do is we try to make sure that we put people on a career path that normally wouldn't be accepted in the healthcare space.
That's wonderful. You know, and looking at the disparities in healthcare amongst ethnic groups, there's a lot of racial disparities. But what's needed, we see, is that your program has helped a lot of people who are labeled as marginalized the opportunity to get in the healthcare field and make a career out of it.
Yeah, so one of the targeted areas that we decided to target was the 50314 and 50316 area codes, because they had the highest unemployment rate, and this happened during a time when Iowa was at 2.3%. So we had one of the lowest unemployment rates in the country. Mm-hmm. And the unemployment rate in those areas was 16%. And if you take into the dynamics of how they determine unemployment, they said that the actual number is closer to 36. So, I mean, we targeted those areas intentionally, and so we were able to successfully get quite a few people from that area, those area codes into the program and get them into careers. And even when they don't work out for Broadlines, we feel like that's a win because they're not going back on welfare, they're not going back to prison, because now they got a skill that they can fall back on.
That's true, man. It really is a God-sent gift, I'm inclined to believe, especially for a lot of young people who are coming out of high school, don't know what direction to go, don't know what to do, trying to figure out your pathway. This program here, I know I've worked with you through Urban Dreams for 4 years, and I noticed that once you get these licensed as a certified nursing assistant, you can even do more with that if you hang on with Broadlawns, right?
Oh, there's quite a bit more that you could do. So like I said, it's an accredited program so some of the programs in Des Moines, what they do, some of the hospitals, what they do is they get you the CNA license, but you're only able to practice at their facilities. If you were to go out and try to transition that into like the CMA or the LPN or something like that, then you would have to go back and go to an accredited school. So we were intentional about picking DMAC as our educational vendor, and that way that you could add on, it was a natural progression instead of a regression.
Okay. I want to let our listening audience know, too, that our viewing audience, that DMAC stands for Des Moines Area Community College. I ain't doing nothing for them. They should put some money in my pocket for saying that. But still, I just wanted to just let y'all know Des Moines Area Community College is the one that is connected and working in collaboration with Broadlawns Hospital to make this thing happen. And I, as a matter of fact, I remember one young man that was from Somalia that got in the program, and you told me last year, this last year, he's going into medical school?
Yeah, he graduated from the University of Iowa. He got his white coat, Abdullahi Muhammad, and so he's into neuroscience. Yeah, let me tell you a story.
Okay.
We met at Smoky Row.
Okay.
And this is years after he went through our training. And man, just to see the growth that he had achieved in those 4 years was amazing. You know, you see a young kid that's the youngest kid in the class, and then he graduates and goes off to college and comes back home, and now he's talking like a grown man.
Oh wow!
And he was a light me. It's like the student teaching the teacher.
Man, that's something, because I know I came in frequently in those past 4 years to talk about soft skills, and to see somebody that came in coming out of high school, you just don't know who these people might be. Some folks think that just as a certified nursing assistant, that's it. But Broadlawns does something extra too, don't they? If an individual completes the program,
So anybody that completes the Teach and Tech program, Teach is for adults and Tech is for our high school students. If you complete the program, you're automatically eligible for the RN apprenticeship. So that's like $16,000 of free education. And you see people talking about education loan repayment.
yeah,
You get to start your career off with no debt.
you can whoop that with a hickory stick.
Man,
Come on. B.B. King had a song back in the day, child support, alimony, she eating steak and I'm eating bologna. Come on. You going to college and you driving up all this debt. Here's a program where you can go for free and get paid while you learn. Get your license and get paid to work there at the company, at that hospital. And if you wanted to continue your education, the hospital pay for it.
That's a fact.
Damn, win. You'd be asinine not to take that opportunity. You know, some people probably would think, oh, all I'm gonna be doing is changing diapers. It's more than that.
But no matter what field you get into, you got to do what you have to do till you can do what you want to do. And the process is the same no matter where you go. You get an entry-level position, and then you work your way up.
You know, like you said, Abdullah, he came in as a CNA.
Yes.
While he was still in high school.
Came home from college and worked the floors.
Okay.
Like everybody else,
Uh-huh.
the rest of the CNAs, and then went back to college and got his degree.
So
now he's applying for Iowa, Minnesota, or and DMU.
Okay.
So those are the med schools that he's going to.
Oh, that's wonderful. And just that's something about the mind. Just like when you're dealing with agriculture, somebody digs the ground and owns the ground and plants a seed, and this program helped plant that seed in that young man, even though it could have been there already.
Yeah.
But what this program did was to put fertilizer or the rain that fell to make that seed grow. And now this particular seed's about to become a neurosurgeon, probably.
Exactly. And so the White Coats movement was started by a brother out in Philadelphia. And now we say teaching tech is the road to white coats, because not only do we have Abdullah, but we have two other young men of from different minority groups, Asian and Latino, and they're also in med school that went through the program. So I mean,
I love this. This is a heck of a program and a great opportunity for young people to get a step in the right direction, you know. But I cringe though when I hear people say minority and they talking about us. Yeah, I know in this country, you know, it shows that we might have a lower percentage, but on this planet, we're the global majority.
And I understand that,
Yeah.
but in Iowa,
Yeah.
so they have these concepts that you have to be cognizant of. See, in Iowa, minority means everything but white males.
Mm-hmm.
So the disabled fall in that category. Women fall into that category. You know, Asians, Latino, everybody but white males.
Mm-hmm.
Now, on the federal level, they decompartmentalize that.
Mm-hmm.
And so women get their own, you know, the disabled get their own,
Mm-hmm.
you know, African Americans get their own. So that's why we're in Iowa. So when I say use the term minority,
Yeah, I got you.
I mean it numerically and, you know, contextually.
Yeah, here in this state, because it is. If it wasn't for a few drops, well, you know. But at one time, it used to say here in this society, if you had one drop, you was 100%.
Yeah.
You know, but still, those days are behind us, and we hope that they stay behind us and not bring that yakety yak junk back up. But we see it in the political climate, the political environment that we're in right now.
I'm going to digress for a minute.
Go ahead, bro.
When we were talking about the program being a road to white coats, you got to understand that blacks only make up 1% of the doctors in the whole United States. That's a problem.
Yes, it is.
Because if you look at the statistics as far as the causes that we go to the hospital,
Mm-hmm.
we are disproportionately represented for almost all diseases that takes place.
Mm-hmm.
Hypertension, diabetes, cancer, all these things we're like 2%. I mean, 50% more likely to have these. And what's really troublesome is these are preventable illnesses.
Yes.
And all it takes is like early detection. Me and Dr. Shaw are working on getting out the message because dementia is becoming a big subject now, especially among African Americans. So it's important that we start publicizing, the disproportionality that we represent in this dementia field, and get people to know that if you do certain things, you can offset any dementia, and it's all about early detection.
That's beautiful, because there needs to be a all-out campaign on that, because we know all of the racial disparities that people of different ethnic groups, other than what they claim they call dominant culture. I remember listening to Dr. David Williams out of Harvard University, West Indian brother, and he stated that your zip code is more important than your bank account to a degree, because if you're in a particular zip code, your life expectancy drops if it's in a poor area.
Man, and your insurance rates go up.
So give the poor people some more hell, huh? Babylon makes the rules. That's the name of this daggone show. So it makes all the sense, because we see disparities. Yet through it all, as a people, I can't speak for other ethnic groups, but I can speak for my own, because I'm a member of it, and I know that resilience is something that we stand on. And my father and my mother, they always told us that failure was not ever come to me talking about failure. You had to keep on pushing regardless of what you think, whatever you're going through. And I saw my parents do it, and now I got to do it. I've been doing it. So if I didn't, I wouldn't be here.
I agree. So the thing about it is, a lot of people try to measure themselves by other people.
Their standards.
Instead of measuring themselves according to themselves. If you strive to be the best that you can be, how can you not be successful?
That's true. I got you, man.
But you can never reach your full potential if you're always trying to be as good as Nagus, or as good as somebody else.
Yeah. You said you had a campaign, and you campaigning to reach out and grab how many people that you're getting ready to do now? You got another cohort coming up?
Oh, 10 people. So we have a cohort starting in January that we're going to hire 10 people to go through the program. That program is pretty full right now. I'll be making some decisions on making the selections for that program. But we have another one starting in March. So 10 more people will be eligible to get in the program. And but let's get something understood. You have to have a passion for healthcare.
True.
This is not something that you're going to get mega rich on unless you reach the heights of Brother Abdullahi. Now, he'll go on and he'll probably make millions of dollars before it's all over. I believe he'll probably be published in the next couple years or something like that, on his journey, because, neuroscience is constantly evolving, so he'll always have something to do. But the journey of 1,000 miles begins with the first step.
That's true.
So, that CNA is probably just the first step on a ladder. So there's many ways, and a lot of people, they watched ER or something, and they believe that all you have is doctors and nurses. And that's not true. There's so many pivot points inside of a hospital. And once you get inside the doors and you see all the other opportunities that exist, and now you're in a community of people who are about that work, and they're eager to, mentor you or help you navigate those halls.
I want to ask you a question. What is the criteria for someone getting in? If they had, in regards to someone that may have a tarnished background, a criminal background, what would be some issues that would deny somebody from coming into this particular program?
Most of the time, I got a criminal background for that matter, so.
I do too.
And I don't think nobody's is as bad as mine was, but
Once upon a time.
DHS has a process that you have to go through.
Mm-hmm.
And it's not what you did, it's how long ago you did it and what have you did since you did it.
Mm-hmm.
You know, so that plays a major role on if you're accepted into the program or not. So you have to get DHS approval. And even if you don't get approved the first time, they'll give you some steps that you need to take to help you get through that process. So it's a lot of diligence. You know, it's easy to ruin your reputation, but you know, it takes time to rehabilitate your reputation.
Without a doubt, man. Without a doubt. It's been 27 years for me now, but still, good Lord. One of these days they might figure out that I'm all right. I'm not as bad as I used to be.
I mean, what you did wasn't all that bad.
No.
When you take it in the context of where we're going to now,
Yeah.
you know, as far as marijuana being acceptable a product.
Mm-hmm.
I mean, I can see Iowa in the next 10 years being a legalized state.
Kim Reynolds, I'll be quiet now. We're surrounding us, right in Missouri, it's legal, and Illinois is legal, and Minnesota is legal, and Nebraska they decriminalized a certain amounts, but Iowa is still just.
But I mean, it's like anything.
Mm-hmm.
After a while, you're going to have to get on the same page because it's going to be too hard to have all these surrounding states, you know, with the legalization, and then like for your workforce and stuff like that, it's hard because we have a marijuana law, you know. So one of the things about our marijuana laws is that now if a person wants to get a job and he has a license to smoke or permit, then what happens when he has to do a drug test?
Yeah, because there's a legal issue they're gonna have to face and have to deal with.
Yeah, they'll have to confront that one day.
Yeah. I'm inclined to believe they're probably facing it right now.
I believe so.
Yeah,
too.
because it's a lot of people who use it for medicinal purposes and they have prescriptions, but still the employer shouldn't be able to deny you that if that's your medical on your health, for your health.
Exactly.
Yeah.
And it all depends on what kind of work you're doing.
Yeah, that's true. That's true, man. Man, Dennis, I just thank you, man, for coming out today. We cut up a little bit here for a few minutes. Would you leave some information where people know how they can contact you and
What you just want me to say?
yeah, tell them your name and probably the email address or whatever so they can contact you.
My email is dhenderson@broadlines.org. My phone number is 515-805-7563, and I am the program coordinator for the TEACH Tech Apprenticeship Program.
So y'all who out there listening and you looking to do something in your life, you don't have to be a spring chicken. You can be one that's been around the corner a little bit and back again. And if you're not working and looking for, and you're concerned or thinking about the healthcare field, I would advise you to reach out to this gentleman because they got a program like none other here in this state. So, you want to say anything else, Dennis?
I'm good.
Well, I'm going to tell you this. I enjoy hanging out with my brother because me and Dennis, we go out and we smoke them supreme premium cigars sometime. I know, and if we can, we might have to leave this show and go to the cigar bar and get us one or two.
I I agree.
Well, my motto is a chicken ain't nothing but a bird. We gonna do this thing. We shouting out to everybody out there in the social media world. This is Dr. Nagus Imhotep coming to you with Babylon Makes the Rules. See you again next time. Y'all have a great one. Bye now.
This podcast is brought to you by Infinite Resources, a local staffing agency connecting diverse job candidates in central Iowa companies.
Amplified.